Unshelling Medicine Podcast. Healthcare in the language we understand.
Hello, everybody. Welcome to our episode today. I have the pleasure of having with us Mr. Donovan Pyle. Donovan is a founder, CEO of Health Compass Consulting. He's also an author, and his book is not suggestive at all. He just goes straight to the point. So the book is Fixing Healthcare. So we're going to talk about healthcare today. There it is. So, if you're a healthcare decision maker, stakeholder, you are in the vein of fixing healthcare on this journey.
You buy healthcare. If you're an executive who buys healthcare.
If you buy, and if you receive healthcare too. So you need to know where it's broken, right?
100%.
So it's going to be a great conversation. Donovan, welcome. I'm so excited we made time to have this conversation today. Now,
Great to see you.
Great to see you. Our listeners are like, well, healthcare is just fine the way it is. Why are you fixing it?
Well, that's actually a really interesting take. And that's one of the reasons I wrote the book is that most executives, let's just level set real quick. U.S. businesses spent $1.3 trillion covering about 164 million Americans last year with healthcare benefits. And here's the thing that most executives don't know. They don't know that 25% of what they spent last year was completely wasted. That on average, that's $4,000 per employee that should be sitting on the profit statement for your business is gone. It's not there. And so I wrote the book to explain the opportunity to executive teams. And then secondly, to help them understand that they have the power to actually solve a lot of these problems and reclaim that lost profit.
Okay, $1,000 per head. That adds up pretty quickly. How did we get here?
Well, it all goes back to the history of these industries, of the health insurance industry, of the benefits brokerage industry. So let me just paint a picture for you. Most finance and HR teams who are providing benefits, buying healthcare for their employees, they have little to no technical expertise in healthcare. They don't understand this area. It's very specialized. It's very nuanced. And you know what? That's okay. They have a million other things that they need to do. And so when businesses don't understand something, they outsource it. They bring in outside experts. Just like I'm the CEO of my consulting firm, I don't want to have to keep up with the changing U.S. tax law from year to year. I don't have the bandwidth for that. What do? I hire an accountant, and they protect my blind spots. They make sure I'm only paying the taxes that my firm should be paying, nothing more. That's their job. However, the situation with healthcare is unique. Since employers don't understand, they have no technical expertise in this area in most cases, they outsource it to benefits brokers, to insurance companies. And at the end of the day, if you understand the history of why health insurers were created, why the brokerage industry was created, you quickly understand that they are supply-side vendors. They are selling you a product. They are not in the business of giving you financial advice on how to maximize your investment as an organization.
So give us a little bit of history behind the insurance brokerage industry and how that was created. For anybody that may like, okay, we've never asked, but these services do exist for our usage. And, if Tom, Dick, and Harry is using it and seemingly worked, why was he created in the first place?
Yeah, great question. So up until the 1920s, as you well know, the medical profession wasn't able to actually cure many things. Okay, right? And most people actually, in the year 1900, most people spent more on cosmetics than they did on healthcare. They spent about $5 on average in the year 1900 on healthcare. $5, 1% of their income. Okay. But as medical advancements came to the fore and hospitals needed to start training nurses like yourselves and doctors, and we're cleaning hospitals, their cost basis went up. So they had to start increasing the price of their services. And this wasn't a terrible investment. They were actually able to start curing people for more diseases. And that's fantastic. But what happened is that in that time period, up until 1929, health insurance didn't exist. There was no need for it. And so the executives at Baylor University Hospital in Dallas, Texas had a great idea. What if we got a large employer to prepay for our services? Okay. And so they struck a deal with the Dallas Teachers Union, and for 50 cents per employee per month, the teachers could come to Baylor University Hospital and have their babies delivered in this nice, clean hospital. It was a massive success, especially given for the hospital, especially given the backdrop of the Great Depression. They were struggling to collect money for the services being rendered. And so they were losing money. They needed a way to stabilize their revenues, and prepaid health plans were the vehicle to do it. Now, here's the fascinating part, though. Executives from around the country took note of this, and they said, wow, how can we create our own health plans in our markets so that we can stabilize our revenues? These hospitals actually funded the creation of health insurers, which later became known as Blue Cross plans, in 14 other regions by 1940.
History is fascinating. The founders, entrepreneurs, you just never know who's going to buy that idea, sell it. Okay, so where do we go from here? Yes, this was created, it worked, and we're finding out that employers are losing money per employee in this system that similarly works. Where do we go from here? Is there anywhere to pivot? How do you come in?
Yeah, there absolutely is. So I want to provide a little bit more context so that
Right.
we can connect the dots a little bit easier. So in essence, in today's media environments, we typically see this dynamic play out where we say with the media kind of positions as like hospitals sit on one side of the table, health insurers sit on the other side of the table, and they have this fight every 12 months over a network contract. In reality, in the commercial marketplace where employer-sponsored marketplace, hospitals and insurance companies are partners. Health insurers are wholesale distribution partners for hospital services. They sell their services for them at a wholesale level. Now, who sells them at the retail level to employers? That's the brokerage industry, okay? So health insurers are wholesalers of hospital services. Brokers are retailers, okay? They are all partners, and they all make more money when costs go up, not down. When the employers and the patients' costs go up, not down, they all make more money. Their role is to move these financial products and services to employers and to patients. That's their job, is to sell products. And so this creates a conflict of interest, because if you're a business, if you're a finance professional and you don't know anything about this area, and by the way, for context, healthcare has become a top 3 expense for most businesses and the fastest growing financial risk on their P&L. This is a major threat to the profitability of American businesses. Most CFOs are making the mistake of asking and expecting their benefits broker to help them maximize the return on their investment. In other words, they expect the broker to help them get the most value for their employee population for the least amount of money, right? That's what they expect. But that's not what brokers are intended to do. They're not intended to provide those financial advisory services. The original reason why the industry was created was to sell products, and some products pay them a lot more than others. So guess what they're going to recommend to an employer? The ones that pay them the best in many cases.
So let's bring this conversation to usage. And you rightfully stated that there's a lot of lost usage or, funds that go unused. So the American healthcare system or the American society, we're getting sicker and sicker. Okay. That is just the truth. I didn't make it up. So there's more chronic diseases diagnosed, there are more acute flare-ups of those chronic diseases. And then we have people that are considered super users. So super users are organ transplant patients, patients who are ventilator dependent in the home, or the dialysis patients, right? So how can a company who has maybe an employee base that has a mix of all of these conditions, and whether it's the employees directly or the family members that are covered under the plan, how can an employee maximize or effectively utilize the benefit plan that they have for the employees, given the needs presented. Because not everybody's going to use their plans, the healthcare coverage or plans the same. We could have an otherwise healthy population, say out of 100, we have maybe about 20 to 15% of the employee base who are on the healthier side of things. Everybody else is kind of chronic. How do you balance that?
Yeah, 100%. So as you're well aware, typically within any employee population, it's about 5% of the employees are driving 50% of the utilization,
Yeah.
right? 50% of the costs are coming from about 5% of the population. So one of the key takeaways that I think it's really important for leadership teams to understand is that at the end of the day, health insurance companies don't take on any risk. Okay. It's the employer and the patients that pay for all this stuff. Okay. and we don't need to go down the rabbit hole as to why that is. We certainly can if you want.
I'm Donovan.
Yes. And that's okay. So at the end of the day, it's the employer and the patients that pay for the hospitalizations, the labs, the imaging, the surgeries, and the drugs. So one of the things that we encourage our clients to change their perspective on is that stop thinking of healthcare as a single line item expense. Stop thinking that okay, we paid $80,000 a month, $1 million a month on health insurance and healthcare, and it's a single line item expense. It's just an expense. It's a cost center. Healthcare is a supply chain like any other. And just like any other supply chain, you need to manage it, okay? And so you want to make sure that you're paying a competitive rate for the hospitalizations, the surgeries, the labs, the imaging, and the drugs, okay? But here's the thing. Most businesses, because they rely on the advice of legacy brokerage firms who don't have the incentive to actually help them manage their supply chain effectively, let alone see it, most businesses, most finance teams are not in a position to actually see their supply chain. Okay, so one of the first things we help our customers do is put them in a position where they can actually start seeing their supply chain. They are actually getting claims reporting to know here's how much we're paying for, ER visits. Here's how much we're paying for Humira, specialty medications, etc. And then one thing that's really interesting that happens when they get visibility into the supply chain is that they start noticing the price variance between locations where services are rendered, different avenues that these services were purchased. And so where I am, I live in Orlando, Florida. Healthcare prices vary over 1,100% in Orlando, Florida. You don't see that in any other marketplace because functional marketplaces where you have pricing information, you have quality metrics visible to consumers, it always forces efficiencies. It always does. And that's the beauty of market-based systems. But we don't really have a true market-based system in America for healthcare, and we haven't in decades. And so what we do is we help employers get them in a position where they can see their supply chain, and then we can show them how to optimize and manage that supply chain.
That is, wow. The very okay. It's Florida.
But it's not just Florida, and I know Florida is very exceptional in a lot of ways. But this is actually pretty commonplace. I mean, most markets around the United States have a price variance for healthcare of over 600%. So, for example, like I went and bought an MRI for myself a few weeks ago because I know how to buy healthcare in a lot of situations. I was able to find an MRI for $400. Okay. Most employees in the same area are buying that same MRI for north of $4,000. And again, it's not the insurance companies that pay for this stuff. It's the employer and the employees that pay for this stuff. Really, I'm encouraging business executive teams to engage in this area because, again, there's a massive opportunity for executive teams who they can gain a strategic advantage in increasing enterprise value, gaining a strategic advantage in the war for talent. And so all of these things just compound to build value over time, but only for those who truly engage.
Yeah. So you mentioned P&L, and we'll get back to P&L. My concern from an advocacy perspective, when encouraging employers to look at their statements and the expenditure when it comes to healthcare, is there a concern that employers may actually use that metric to discriminate against hiring certain people because maybe they have a pre-existing condition, which is one of the things that was really mentioned in the Affordable Care Act when we came into usage. Is there a concern that that might happen? Because we have seen tools that were meant to help in one way or the other used as a tool to further the disparity that we already have in today's healthcare system.
Yeah, I'm so glad you asked that question, and it is an important question, but luckily there are a lot of safeguards around this.
Okay.
Employers who gain access to this information, they have to have firewalls and strict policies and procedures around dealing with HIPAA-protected information. You're not allowed to ask people about their personal health conditions throughout the hiring process, unless it's a very specific job that they have to have, meet certain thresholds for and be able to perform. So the answer to your question is that it's actually not a concern. There are ways around this. And yes, I mean, there are strict rules around discriminating against employees because of their health conditions. And so I understand why you asked the question. I'm glad you did. But just know that it's really not a concern. In fact, 60% of businesses, of employees, are actually on partially self-funded health plans, many of which provide some visibility to claims data. Not all of it's identified claims data, but much of it is. So, it's really not a concern. The bigger concern is continuing to bankrupt your company and your employees by not engaging and helping to keep them well.
Okay. Thank you for saying that, because that would be a concern to anybody listening to us and anybody who advocates for better healthcare delivery. So when it comes to P&L, most employers, most CEOs don't look at their P&L until it's tax season. Most. I didn't say all. So hold your horses if you do. Most do not. So when it comes to healthcare expenditure, is this something that you encourage founder CEOs to maybe not look at it themselves, but have people in place to look at, talking about safeguards, look at the expenditure and, find out ways to better save money or consult with somebody like yourself?
Yeah. So from a product perspective, there is no silver bullet that is going to be a good fit for every business, let alone most businesses. There just isn't. And there's a good reason for that. Every business uses benefits for slightly different reasons in different ways. So basically, every business will say, yes, we want to put ourselves in a competitive position to attract and retain the talent we need to support our human capital objectives and our broader business objectives. Okay, great. But you know what? Every labor market by industry is different. The benchmarking on what competitors are doing from a benefits perspective is often different by industry. And so I think this is why having an unbiased partner in helping you understand, especially if you've got a bunch of early stage founders on the call, maybe why even offer benefits? Like if you're going to make this really big investment and take on some more administrative work to have these programs, let's just back up and make sure we're being really intentional about what success is and the reason that we even do this. Because occasionally I'll have a founder or small business owner call me and we don't really work with small businesses or early stage businesses, but they'll just call me for advice. And I'll say, well, how competitive is the labor market? And so if it's really easy to hire people, maybe the right answer is that, and if you're a bootstrapping company, you don't have a bunch of money just to throw around, maybe the right choice isn't to offer benefits. Maybe the right choice is that they're getting a decent subsidy on the exchange. Maybe they're on health sharing organizations that provide an amazing amount of value for certain, demographics. So I know it's just common part of our culture to assume that every employer should be offering benefits, especially early stage businesses. I'd be really intentional about what success looks like and why you're doing it before you make that leap.
Thank you for that advice. Much needed. That's why if you can go fractional, go fractional. It'll save you a lot of...
Yeah, and that's the whole thing. It's like, because we don't, like firms like mine, we don't get paid to sell products. We sell services, like consulting services, procurement services, implementation and management services. I can tell businesses, hey, listen, don't buy this. Right? I'm going to get paid the same amount regardless, but I can save a business millions of dollars because they don't need this product. The product that they're thinking about investing in, is actually not going to deliver a return for them.
Right.
Right. I mean, we just developed a survey tool for employees, what we call Employee Benefits Voice. Great little tool, easy to deploy, and get feedback from your employees. What do they actually value?
Right.
Before you go and spend millions of dollars on something, make sure that they actually care about it. It seems so obvious, but frankly, a lot of businesses aren't doing those simple things. And so they end up wasting a lot of money just because, well, this is what we've always done. We've always offered this and we've always paid for this. Well, maybe it makes sense, but maybe it doesn't.
What this reminds me of is like when you're starting out anything or any business or building something, you validate the concept, right? So that is what I see that most employers don't do. I just was having a conversation with somebody before our call today, and we're talking about the EMR and e-charge systems and how healthcare in general, the healthcare systems in general, have a habit of consulting with technicians to build a software for nurses and doctors to use and support staff, attendants, CNAs, you name them, right? But you don't talk to the people actually using it. And then we have to go through the cycle of iteration. And by the time we get to some usable form, guess what? There's a new candy in town that we have to all go to. And I think just talking to people, we've lost the culture of communication. We've lost the culture of having that exchange, conversing to really find out what is going on. And I think it will save us a lot of headache as a society.
I am with you 100%. And I think we're still dealing with the aftermaths of COVID in so many ways. I mean, ways that we don't even consciously recognize. Yeah. Like I know for sure my social skills are not as good as they used to be. I know it, like, because we had 3 years where we just weren't really getting out and talking to people. So no, I agree 100%. And an entrepreneur that I'm a huge fan of, his name is Daniel Priestley. And one of the things that he talks about is getting signals of interest before you build anything as a founder, before you get investors, before you do any of that stuff. Get signals of interest. And one of the ways that you can do that he talks about is building a wait list, right? Hey, like I said, if I were to build this thing, would you be interested in it? That's a very low commitment engagement, right? So, and then you can take that list and go to your investors and say, hey, listen, I've got thousands of people that are interested in this thing. What do you think? But yeah, I mean, it's just amazing. We will do all of these tactile things before asking the obvious obvious questions of, is this even something that people want?
Absolutely. And I think we need to gradually get back to that. COVID did a number and compounded with, wanting to be right all the time. So we've got to get back to basics, which is communicating or conversing. Donovan, question for you. What made you embark on this journey? You could have done so many different things, but you decided, you know what, I'm going to try to help employers save money. What was it? What was the trigger for you?
Yeah, it's a great question. I think for the folks that grow up in America, we are so lucky to have so many choices. But at the other side of that coin is that choice is a tax in many cases. So yeah, we're kind of like swimming in this ocean of freedom, and that can present its own challenges. But I'll tell you the truth, I wasn't setting out to do anything really revolutionary, to be honest with you. At the point that I left the music industry on a full-time basis and got into the risk management industry, I honestly, this was the bottom of the Great Recession. I was looking for stability. I'll be very transparent with you. I was looking for stability. I was sick of going to bed at 6 a.m. I wanted to start waking up at 6 a.m. and just being a normal person. And so I was lucky to get hired by an insurance company that was later acquired by Chubb and rebranded as Chubb, called Combined Insurance. And I was actually super lucky to land there because the founder of that company was a gentleman by the name of W. Clement Stone. And he was worth $600 million in like 1990. And he started his insurance company called Combined Insurance in 1916 with $100, like one of those just amazing, like Rockefeller type stories, right? But the reason that was really good for me was the culture he had developed this whole system and methodology about living. And a big part of his culture was a thing that he called PMA, positive mental attitude. And it wasn't just a slogan on the wall. And when I got there, it was like the culture was like oozing with it. Like it was like a real thing. And Brad Bennett, who was our CEO when we were acquired by Chubb, he loved to tell the story of how, there's all these transition consultants that they had hired.
Right.
For M&A purposes. The consultants were asking like, so are you going to keep this whole like PMA thing, this whole positive mental attitude thing? It seems kind of like antiquated and old timey. And he's like, well, what's the alternative? Like, what do you want? A negative mental attitude? Like, no, we are keeping it, especially for an entrepreneurial company like that. It's so important to keep your head right. And all the founders on the call know exactly what I'm talking about. Anyway, that was just an amazing place for me to land. I worked my way up through the business. I'm going to answer your question in a second here. During the tail end of my tenure, with the company, I was noticed, benefits brokers were my customers. And so we would sell our disability products, et cetera, through benefits brokers who would sell them to employers. That's the distribution channel. And I was noticing that healthcare kept on being a problem at these open enrollment meetings. And the leadership teams were frustrated with rising healthcare costs. The employees were frustrated with rising healthcare costs. And I live in Orlando, Florida. And luckily, there's a gentleman by the name of Harris Rosen who started Rosen Hotels in 1974. 1990, he got fed up with the way that he was buying healthcare for his employees. And he said, forget this. I'm starting with a clean sheet of paper. I'm firing my broker. I'm firing the insurance company. I'm going to do things my own way. And here's the great news. Over the next 30 years, he found ways to save his company over $500 million and doing it by providing a superior health plan for his employees.
$500 million?
$500 million over 30 years. I mean, just an incredible story. So much so that he is now more well known in Orlando for his philanthropic work that he's done for decades, sending disadvantaged kids to colleges, all this amazing stuff. And he credits his ability to do that because he stopped blindly giving his money to insurance companies. I mean, so it was really inspiring to me. And when I saw the frustration of employers and patients at these open enrollment meetings, I was like, wow, why aren't these brokers doing this? And I very naively thought, geez, if I just move to the brokerage side of the business, I can start scaling those kinds of innovative solutions. I can probably help a lot of people and I can probably make some money doing it. And I very quickly realized that that assertion was completely wrong. That is not what brokers are in the business of doing. They work for the insurance companies. They get paid to sell products, not help employers maximize healthcare investments.
Thank you. A lot of gems and a lot of stories that I didn't know and I'm going to look into. Thank you so much, Donovan. So tell us about your book. So your book, Fixing Healthcare.
Yes. So Fixing Healthcare, the subtitle is How Executives Can Save Their People, Their Business, and the Economy. I wrote the book for 3 reasons. Number one, we already covered. Most executives don't know that 25% of what they're spending is completely wasted. And that's the most conservative estimate. That's $4,000 per employee per year. Number two, most executives don't know that they already have the power to solve these problems themselves. They don't need any action from Washington, D.C. In fact, the rules on the books actually want them to solve those problems. They have a fiduciary responsibility to solve those problems. Now, the missing link, though, and this is the third reason why I wrote the book, was no one's given them the executive playbook needed to solve those problems. What's the process to go through so that we can meaningfully reclaim that lost profit each year by improving benefits and coverage for our employees? So that's really the thesis for the book. It's not about products. There's a million products out there. It's about finding the right, using a fiduciary process to find out what are the right products and solutions that we should be using for our organization to meet our human capital objectives and broader business needs.
Beautiful. So for all the listeners, people listening to us have this conversation who are stakeholders, decision makers, whether in healthcare, whether in companies, because you do work with big companies, large companies that are paying a substantial amount of money yearly for healthcare coverage. Where can they find you, to consult with you and work with you?
Sure. So if you just go to fixinghealthcare.com, there's a bunch of resources there. if you're an executive, I'd encourage you to just download the free executive summary of the book. If you're an employee who's fed up with rising healthcare costs or stagnant low wages, download the executive summary of the book and give it to your boss. They have the power to solve these problems, but only if they know how.
Absolutely. Beautiful. So I am a sucker for knowledge and gems. I often ask my guests, please, before, we part ways, do you have a golden nugget or a few golden nuggets to share with our listeners, especially when it comes to healthcare costs, rising healthcare costs, I should say?
Sure. So here's the reality. Most executive teams do not have the bandwidth to become experts in this space.
Mhm.
It's complicated. It changes all the time. It's very dynamic. And so the highest leverage thing you can do as an executive team is get unbiased professional advice. Okay. Again, I don't want to keep up with U.S. tax policy every year. I hire a CPA. They work for me. Don't hire the CPA who, metaphorically speaking, gets paid by the IRS. That's what you've been doing for years, and you can see that it's not working. It's not sustainable. You need to get unbiased advice. There's two ways to do it. You can hire a fiduciary-based management consulting firm like mine, and there's a bunch of us that have emerged in the market over the last 10 years, and you can have a fractional professional maximize your investment. The other way to do it is to, if you're a larger organization, let's say you have more than 1,000 employees, find a qualified benefits professional. Here's two easy indicators to look for. They're either certified health value professionals, that's like a PhD in health plan innovation, or they're registered employee benefits consultants. That's similar, akin to like a master's degree in this area. Find them, put them on your payroll. Okay. This way, they don't have conflicts of interest. Okay. The return on that investment can be 30 to 1, depending on how effective they are, the size of your organization, et cetera. Well worth the investment. But, like I said in the book, getting unbiased advice is the first step in healthcare transformation. If you don't get unbiased advice, you're never going to get to the second step, let alone to the sixth. So that's the first thing I encourage executive teams to focus on.
Thank you for that. And where can we get your book? Where can we purchase a copy?
Yeah, it's on all the channels. I'd encourage you to go to fixinghealthcare.com and buy it from us directly, but you can certainly go to Amazon or any of the other channels. By the way, there's actually a counterfeit book that I just saw on Amazon. We just had it taken down called Fixing Healthcare Costs. It's just amazing. Some AI bot put this thing out on Amazon 3 days after I released my book. So don't buy that one. Buy the real thing. It's got my name on it.
It's scary stuff. Wow.
Yeah, fascinating.
Fascinating is not the word. It's that was cleaner. So yes, fascinating.
Oh, by the way, quick story. So one of my uncles was skeptical about the thesis of my book.
Okay.
He was actually a beta reader. And so after the book came out, he took the entire manuscript and he fed it through ChatGPT, and he asked ChatGPT, hey, listen, is Donovan Pyle right or wrong? And it mostly agreed with me. I had one major criticism, that my book doesn't cover things that executive teams have no control over. Okay. It only deals with the things they actually can control and affect. And I was like, yes, exactly. That was the point of this book, right? Because so many people love to have these like thought experiment conversations about if we could just start over again. And if we were like the ultimate central planner, we were like Lee Kuan Yew in Singapore or something. How could we just like redesign this whole system? That's a fun conversation to have. But you know what? These leadership teams, they got to manage a P&L right now. Here's what you can do right now without any action from Washington, D.C. You already have the power. You already have the authority. You just needed the clarity and the roadmap. Now you have it.
Absolutely. Practical approach. It has to be practical. If it's not practical, then it's just, a fantasy. So that criticism is well received. That was the point. The point exactly. My goodness, this was such a great conversation. There's more to this. I would like to go down a few rabbit holes with you. Maybe we'll have another segment just to kind of like peel back the layers a little bit. But please, for anybody who maybe you didn't catch everything, don't worry about it. We'll make it available in the show notes. Check it out. Check out the book, check out the website, consult if you're a big, large company who has a large expenditure on healthcare, because again, it's one of those things you have to offer your employees. But Donovan, It was such a great opportunity having you and having this conversation with you. And thank you.
Thank you for the opportunity. Great to see you.
Thank you. Same here. All right. Thank you, everybody. Bye-bye. Take care.
Thanks for tuning in to Unshelling Medicine Podcast. If you want to stay up to date with the latest episodes, make sure to hit that subscribe button on your favorite podcast platform. If you enjoyed today's episode, please take a moment to leave us a review. Follow us on social media at Altruistic Scribe on Instagram, TikTok, Facebook, YouTube, and LinkedIn. We share additional tips, updates, and health-related content that you won't want to miss. Have any questions or topics you'd like us to cover in future episodes? Reach out to us at altruisticscribeco.com. We're always eager to hear from our listeners and tackle the health topics that matter most to you. Until next time, stay healthy and take care.